In honor of Men's Health Month, we will be having a discussion today, breaking the silence around prostate health. I will be your host and moderator. My name is Kamei Simpson, and I am the patient engagement lead at Ancora.ai. I lead patient outreach and work on educational content creation. I want to make sure that Ancora.ai can meet the needs of every cancer patient who could benefit from clinical trials. My educational background at the master's level is in public health, and my research at Charité's Berlin School of Public Health focuses on racial discrimination and disparities in the healthcare system. I would like to take some time to set up the objectives of this Facebook Live session. Please ask questions in the chat or feel free to follow up with us afterwards. The objectives for the day include the following. We will talk about men's health behaviors concerning prostate cancer symptoms and screening. Then we will discuss the ways that a prostate cancer diagnosis affects men's sexual and mental health. And finally, since prostate cancer clinical trials may be a treatment option for many men, we will examine barriers to equitable access to these trials. Please feel free to follow us on Facebook. And if you don't already, visit Ancora.ai and learn more about clinical trials and sign up for our free trial matching service. So as you can see, I'm joined by a wonderful panel of 3 other people. We have Chris Lewis, Ifoma Nembhard, and Lorraine Grover. At this time, I would like to ask the 3 of you to introduce yourselves to the audience and share a bit about yourself. Starting with Chris Lewis, please.
Thank you, Kamei. My name's Chris Lewis. I'm a patient expert, I guess. I've had mantle cell lymphoma, which is a blood cancer. I've had a stem cell transplant and lots of treatment. I've now become a blogger, which I've been doing for 10 years. I'm all across social media, just basically helping people affected by cancer to try and live the life that they want to live. And I've been volunteering at my local cancer centre with the prostate group. I've been doing that for 10 years. So that's where my knowledge of prostate cancer comes from. Thank you.
Next, we have Ifoma, please.
Thanks, Kamei. Hi, everybody. My name is Ifoma Nembhard. I run the organisation Prostate Cancer Black Men. And I started this just over a year ago, just about a year ago, after my dad died from prostate cancer. He was diagnosed at the age of about 67. And he had advanced prostate cancer, Gleason score 10, and it had already spread to lymph nodes at the time. So we sort of went through our journey, and going through the journey, I sort of recognized that there wasn't that much awareness, understanding of prostate cancer, especially in the Black community. So we've set up this organisation just really to help to raise awareness, not just with older men, but also with younger men and women as well. Occasionally women are the ones that sort of send our men off to the doctors, but just to share that information, to raise the knowledge before they're diagnosed with cancer, to encourage conversations, know your family history, and just to share information around healthy living and the things that you can do to help to reduce the risk of prostate cancer as well. Thank you.
And Lorraine?
Hi, everybody. I've been a nurse for 40 years and I've been in the field of prostate cancer for 27. And what became quite apparent to me was that in the early days of me doing my clinics and seeing men with prostate cancer and being diagnosed and treated, was that the sexual part of their lives was really affected, yet nobody was really addressing it. And funnily enough, I got into this job by doing clinical trials. So it was wonderful that it was able to, and I can talk a bit about that later on. So I then trained as a sex therapist. So I am a clinical nurse specialist and a sex therapist. And that combination, I feel, professionally has engaged me to be able to talk to patients about sexuality within prostate cancer primarily, because that's been an absolute passion of mine and will continue to be until I do see it improved worldwide. And I have my own thoughts about that. So hopefully we can share some of that as we talk along on this event.
Thank you. So I think it's best if we jump right in. Lorraine, can you please give us a quick overview of the prostate, its functions, and its importance?
So interestingly, the prostate gland is an internal organ, because not everybody knows where it is, and it's here. So it's between the bladder and the penis, and it's sort of a ping pong ball or walnut-sized, smooth, rubbery organ, and it's part of the reproductive system, which is interesting because it tends to seem to fall within urology a lot of the time, but it is part of the reproductive organ. And it produces the fluid, and PSA is part of that, which mixes with sperm here produced in the testes to make semen. So it's ejaculated out of the body. So as the prostate contracts, it expels the ejaculation out. And that's quite an important part of men in their sexuality sometimes. So the tube from the urine, the urethra, that runs through the prostate gland, so it comes out through the penis when you urinate or pee. As the prostate may get enlarged sometimes, as can often happen as men get older, it can squeeze on this tube, and then people develop problems in passing urine because it's like squeezing on a straw. The flow is reduced. And some treatments that get given to help with the prostate gland and urination can affect sexuality because of the treatment of the smooth muscle of the prostate gland, which is what it's made up of. So that's the prostate gland. Sometimes people say prostrate, but that's when you're lying flat, and it's prostate because it's actually before the bladder, and it's about being before prostate. That's in Greek, that's what that means. So that's the prostate gland.
Thank you. So Chris, as you said that you run this prostate cancer support group, does prostate cancer always include symptoms? Do you hear this from other men that you work with in your advocacy work? How do people usually know that something is wrong?
The most common, Kamei, the most common symptom that I hear is the problem of peeing, basically. Generally, the frequency goes up, but the problem also that I see is that's something that we tend to believe comes with older age. So the problem being there that a lot of men understand that, or they think that is actually a natural thing, that as they're getting older, that's something. So that's where the problem comes. They think it's natural, but so actually they don't believe that there's a problem there, and that's one of the most common issues. So of course, by the time they do find a problem, there is a real problem, and you know, a lot of it is stage 3 and stage 4 by the time it is actually diagnosed. Also, the fact that obviously it's a men's disease, and there are many issues culturally with men, wherever we are in the world. We're not great at going to the doctor, so you know, that makes the problem actually even worse. And of course, now we are, you know, very multicultural. That varies between different sectors. You know, and my guys don't want to go to the doctors, and I know through different faiths and different experiences that of people that we talk to, I know it's even harder in some cultures to get men to go to the doctor to get these things checked out. And nobody, you know, nobody wants to go to the doctor when they don't feel that there's a legitimate problem. And prostate cancer is one of those, unfortunately. So it's very, very common for me anyway, to see very few symptoms that are worrying men.
Okay. And Ifoma, you mentioned that one of the reasons why you started Prostate Cancer Black Men was to help reduce this number of men that are finding out about prostate cancer too late. So what can we do to change the status quo?
Mhm. So I think one of the main things that we can do, I think, is just to talk about it. Sometimes in the Black community, we don't really talk about why people have been ill. You might hear that somebody passed away, and we don't really talk. You just hear they were ill and then they passed away. But really being able to talk about illnesses, being able to talk about your family history and understand things like that, I think is so important, because it just gives some context. It allows you to know what you're prone to, or just things that are around. I had no idea that we had breast cancer in my family, for example. I found that out a couple of years ago, while my dad was getting very ill, and he mentioned that his sister had breast cancer. And then all of a sudden things started making a little bit more sense, with dad having prostate cancer. And now I have my brother and sister who are co-founders with me. We have to be more aware about things like breast and ovarian and prostate cancer. So I think just having those conversations, but also just being aware, being aware of things like your health, what you eat, how much you exercise, your weight, how are you moving. Those sorts of things are so important to also make sure that you're doing, and just make sure that you're having the conversations as well. Make sure that children are aware before they get to that age, so that as Chris said, you don't get to a certain age and start to have problems and just think, oh, it's just me getting old, where it's not necessarily the case. And it's also not necessarily the case that it's older people. Black men seem to get it a little bit younger as well, so you might not actually feel that old, and you might not actually get any symptoms as well. My dad didn't have any symptoms really before he got quite severe symptoms where we knew something definitely was wrong, but there was nothing before that. So just having, I think, that sort of openness in conversation, and just the knowledge of the amount of risk that you have as well, I think is important.
Of course.
Yeah, I would chip in with that as well, Fema, that you're absolutely right. That family risk and not having any symptoms of problems with peeing. But if you know there's a family risk and there's an incidence of breast cancer, that's a flag, and that you actually have this conversation and normalise it.
Yeah, absolutely. Yeah.
Was sex ever discussed, or is it ever discussed within your culture at all, Fema?
I would have thought so. I mean, within my family, we're quite an open family, but I don't think we go as far as to discuss like my mum and dad's sex life or anything like that. So I don't know that that was affected or not affected. It was, I think, once my dad got diagnosed, everything was very much around just, how can we get him better? How can we make sure that he's as comfortable as possible? So quite honestly, I don't know if it affected, things like,
and not even about your own personal situation, but young Black men. Mm-hmm. How about in your culture, how was sex seen? Because I think that's some of the silence, that we're talking about now, really. It's about prostate cancer, and sex is part of that.
I think from a Black perspective, especially the prostate area, and just that area in general, is a very sensitive topic for men. So, and I'm generalizing here, I've been on many panels and had many conversations with men that have gone to get checked, and they've had their DRE and things like that. But for a lot of men within the Black community, even that concept of somebody sort of sticking their finger up your bum to check that your prostate is okay is an absolute no. That's something that they're like, no, I'm not going to do that, and it's just seen very negatively, and not necessarily seen from a point of view of this is something that's going to take a few seconds, that's going to save your life and allow you to be here for many years, or to be able to see your family. So I think there is stigma around it in that way, and a bit of negative emotion for some men, especially when you discuss the examination side of things.
Yeah. And I think if I could just point out, like you said, about the finger up the bum, the reason why that happens, and sometimes that communication might help people to think, oh, I understand now why that would happen, is when there is a DRE or a digital rectal examination and a well lubricated finger goes up here, it's at the back, the rectum's at the back of the prostate. So you can actually then feel the prostate gland to check it's smooth and what the size is roughly. And that's why the DRE happens. And maybe that might help some people have a bit more understanding as to why it needs to happen ideally, because it's a mixture of PSA and a DRE. Yeah.
Absolutely. I mean, the purpose of this Facebook Live is really to talk about how a prostate cancer diagnosis affects men's sexual health and their behavior, their mental health. This is so important because we already see those connections. To know that you will now have to have certain procedures done, certain screening may affect someone's mental health, and they may worry about, well, am I going to be able to sexually perform? Maybe some men might feel, I don't even want to know what my status is. Could we also start talking about what are some solutions that we can apply to improve these things?
Well, I think if we normalise that discussion very early on in the pathway, so when we might be screening men for whatever reason, or a man is presenting to a healthcare professional because they've got risk, for example, what we're hearing, that the healthcare professional will normalise the discussion around sexuality and have somebody experienced and trained to do that, because it does need training and experience. When I was a CNS, I could do it to a certain level, but it's completely different now that I've got my sex therapy training. It would be like being a surgeon and suddenly, go on and do the surgery. You have to have the training. So I think early on, it shouldn't be at the bottom of the agenda discussing sexuality. Continence tends to get mentioned, and it's a bit of a quiet word about sex. And actually, it's a reproductive organ. It's going to be involved with the whole reproduction, sperm, ejaculate, the things that people find fun, enjoyable, part of fertility. It's very high up on the agenda. So I think if we could early on have that discussion as part of a multidisciplinary team, that might help break some of the taboos, because there is lots of help available if you know about it. And some men may shut off because they don't know about that, or they've heard their friend have it and it was a negative experience, so they assume it will be for them. But everybody is different. And so I do think early on, having that multidisciplinary team and having a special session on sexuality, which will include function as well as mental health. Because I think at the moment, historically, it tends to be about function. It's about getting the erection, but sexuality is more than that. And it's about intimacy. It may be about relationships. It may be about forming a relationship if you're not in one. So there are lots of aspects regarding sexuality and prostate cancer that we have to think about, not just about a hard penis. And what the goal is for the patient, because that will vary. Clinically, I will see some men who at the very beginning say, actually, and I've had it multiple times where patients have said, as soon as I got told I got cancer, I wasn't fearful of dying. I was fearful of losing my erection or not being able to satisfy my partner. And they didn't hear anything else in the room. So I think we have to be open as healthcare professionals that we don't bias ourselves with the information that we choose to give the patients. Patients should have choice, whether it's choice in treatments, choice in trials. It's the patient we are on about, not our own individual professional accountability to what we think is right.
You're right, Lorraine, but the experience that I find pretty frequently, I mean, as you know, men are getting diagnosed every single day with prostate cancer, and it quite honestly, it shocks me the frequency of the people, the new members that we see at our group. And literally only about a month ago, a very good friend of mine got diagnosed, and he got onto me and he said, I know you run the group and whatever, could I come along? And it was his first experience of cancer. Now, he's one of those guys that we were talking about earlier. He had no symptoms other than the frequency of urination. And he's now stage 4. And actually the cancer's gone into his bones, and there are various other complications arise. But in his instance, which is fairly common, I have to say, he was so shocked once he'd heard the word cancer, which I know because I do multi-tumor work, and it's the same pretty much throughout. Anybody who doesn't have any direct experience of cancer, once they're told that they have cancer, to whatever the degree, their life is changed. Their life is changed forever. Not just physically, but what you said, Lorraine, emotionally. And that word is such a shocker that there is support definitely required for people. And I found prostate cancer to be honestly one of the worst cancers that affects people so badly psychologically. Not just the person that has it, but you're right, Lorraine, the partners, the other halves, the relationship, how the relationships change. And let's be honest, most good lives are built on solid relationships. And quite honestly, it's hard enough to deal with a cancer diagnosis, let alone if you're trying to keep your relationship going as well. I was very fortunate when my cancer came, which I said earlier wasn't prostate cancer, but I have a brilliant family around me, brilliant family and friends, and that's where I got the support. And I knew that all I had to do was to concentrate on trying to get treated and trying to get better from it. But the problems with relationships and stuff, that is one of the biggest complications, and which I believe is underestimated. And I know the work that Lorraine does, and I know she's flying the flag for the psychological issues. And that definitely is where we need more backup, because people are absolutely shocked on diagnosis. Prostate cancer as well, as we all know here, and I'm sure a lot of the viewers know, that there are, there's not just one solution for your diagnosis. Generally, there are choices to be made. And what happens is that someone comes away, and of course, if they're speaking to a surgeon, the surgeon's going to suggest surgery, right? If they're speaking to a consultant, there may be other suggestions. And when you've gone after your appointment, you're just so confused about the choices of treatment and about what that's going to do to your life. And it's like, generally, well, we need to know from you. We want you back in a fortnight or 3 or 4 weeks to discuss what you've decided. And these are life-changing decisions. And I don't see, if I'm honest, I don't see enough support given to those people.
Yeah, I think I have to agree with you, Chris, just especially on the family side of things. I think mental health, again, has a lot of stigma in the Black community anyway. So, getting men, once they're diagnosed, to talk, if they're not that way inclined, might be difficult. But having family around, or having people around, I think is just so important. That's one of the things that I remember my dad saying, used to just make him feel better, just having us around. And COVID has obviously complicated things slightly, but being in those appointments as well, at least 2 or 3 of us would be there at the appointment, and all of us would be taking notes. And at the end, we'd all have different notes, that we could put together, because there's so much information and there's so much that's being given. One, for the person who's been diagnosed, it's a lot to take in. You're still trying to process the last thing that was said, let alone, the various different options that you've been given. So, I think it's just so important to have that support network around you, whether that's family or friends or a support group, like what you run, Chris, having other people around you that you can talk to, or at least have around you, even if it's not talking about your diagnosis, but at least know that you have some support so that you can just focus on the things that you need to focus on. But I think just that, as well as the stigma of mental health, you know, within our community, is something pretty huge as well.
I think if you can acknowledge to somebody, it's okay to feel like you're feeling. Give people space and time, you know, because sometimes it's just normalizing. It's normal to feel like that. There's this it's a trauma. You know, I used to be an accident and emergency sister years ago, and trauma was a specialty of mine. And I actually say it still is, because it is traumatic. You said it, Chris, you are the patient and you're talking from grassroots level. And the patients who might cry or get absolutely angry as is why it's happened to them, it's as important that I sit and listen to that and maybe pass a tissue and just give them that time to express that, because that's part of care. That's part of managing a situation. And the intimacy you were saying about your family, you know, touching and holding and hugging, that's part of intimacy. And I know through my experience talking to so many patients that that intimacy can shift between the dynamics of a couple. And couples tend not to talk about sex. They may have sex, they may be intimate, they may not have sex, and they're in a very stable relationship. But when something wobbles that apple cart of things, such as a cancer diagnosis, people can become insular and they don't feel that they can talk about things, or they've never talked about sex. So it's really difficult now. How do we reinstigate some intimacy when I've had hormone treatment, or I've had radical prostatectomy, or actually I'm on active surveillance, or actually, sadly, there may not be a curative. You know, is somebody with somebody, laying with them in a bed, you know, in privacy? There's a whole spectrum. So it's not just at one point, it can be anywhere along that spectrum of the management. We should be there to take up helping people. And humour might be part of that. You know, I love hearing about cultures, because I can only know about my own that I live in, but I want to get into other people's cultures and understand. So I try and break ice sometimes and say, what do you call your penis then? What's the nickname? What do you call masturbation? Because actually it really helps me, and the language. And sometimes the man might engage a bit more and relax a little bit more, because I'm open to that. I've got lots of sex toys and all sorts of things that I teach with. I've got a variety of colours of penises, because I realised not long ago I only had a white one. How pathetic was that? And I sorted that one out. So I've got a nice little spectrum that I will get out because I want to engage and feel like that. And I think that's what we should all be doing, about diversity and being open to everybody that comes into our clinical conscience, is that we are open-minded and we embrace different cultures. And it's up to us as well to help learn about that too. So I would hope that that may help yourself with your mission, Efima, with you and your family, that, like you've said, spreading the word and trying to get people to relax more and understand the risk and why it's important, and not be anxious about going forward to get help.
Actually, one thing I find, sorry, Kamai, one thing I find quite funny, actually, and Lorraine, you're bang on with the humour, because humour, for me personally, is my biggest weapon, probably. I'm fortunate I'm able to make people laugh, and that worried me at the start when I was on my cancer journey, because I thought, who's got cancer and they want to laugh? Well, actually, everyone, as it happens. But going back to the prostate cancer situation, men, you know, I spoke earlier that men are not very good at talking about things. You know, we're poor, and generally, even with our greatest of friends, I think there are two subjects that are pretty much taboo. One is your personal finance, and the other is your personal sex life, right? And those are with people that you've been friends for 30, 40 years. But in my group, those boys, when they come in, don't stop chatting, and they talk about anything. But I mean, we do have ladies that come to the group because they want to come with their husbands, but generally 99% of the meetings are purely men. And they can't stop chatting about the bits they've had cut off and how their penis has shrunk to half the size. And when they open their pants, they can't find it anymore once they've had an operation. And it's actually incredible when you get a group of men together, how they open up. But actually, in an individual circumstance, it doesn't happen.
That is really fascinating to know, and to know methods that actually work when it comes to getting men to open up and talk, especially about these taboo topics. Now, I do want to move on to talking about clinical trials. We have some questions that have been asked, and we also want to make sure there's time for them. So I will begin by explaining what clinical trials are. We've heard about options a lot in this session, and we've talked about the importance of having options. In prostate cancer specifically, there can be a lot of options given to patients and their caregivers when it comes to treatment. And clinical trial is a study of a new medication, protocol, or device to evaluate whether this new method is safe and effective. And data from clinical trials are used to decide whether treatments are approved for outside of research settings in actual medical care. Clinical trials are important to the discovery and development and approval of prescription therapeutic drugs. And for patients participating in trials, there are several benefits that can include access to innovative medicine. However, some patients don't have access to clinical trials because they actually never hear about them in their care. Costs, transportation, and insurance issues can stand in the way. And clinical trial information is often hard to understand. It's written in medical jargon, and some patients simply feel overwhelmed by all of this information. There's also stigma surrounding clinical trials. So I want to ask Ifoma, are there any specific barriers to clinical trial access that you have seen in any sort of Black, Asian, minority ethnic communities?
I think a lot of what you listed in terms of just access to them, but also knowledge of what's involved in the clinical trials. I think typically, especially if it's for men going through it, there might be some stigma around being the sort of a test case, if you will, and sort of wanting to go with a tried and proven method. My dad did actually go on a clinical trial at the time. There was a Stampede trial that was happening, and we sort of talked about it as a family, and he was quite open to being on that trial. Unfortunately, it didn't lead anywhere, but I think we had a great there was a great sort of researcher guy that worked with us and gave us all of the information, and that was very helpful. So I think having access to that sort of thing, but outside of that, so even before perhaps men are diagnosed with prostate cancer, there are clinical trials that you can join. I'm sure that Ancora has some of these on their site as well, but you've got some of the trials. There's a profile study that's going on at the moment where they do have trials, and they do have studies where they're looking at what affects Black men the way, or why does it affect Black men the way that it affects Black men, and what can we do about it? And I think there's two parts to it, isn't it? One, being able to find out that information, we're helping our future generations, our sons, the rest of our families, hopefully not have to go through, some of the things that some of the men are going through right now. But also it just helps to provides new information, helps to provide new potential medication, new potential treatments. And I think for within the Black community, just thinking about things in that way is going to be helpful. But there needs to just be more communication. I think a lot more awareness, a lot more just talking, and not just to, older generation. Sometimes you have to talk to the younger generation as well. We do a bit of work with universities as well, because sometimes, you know, the younger generation are a bit more open to things, can talk to your dad, talk to your granddad, you know, talk to mum, and then mum talks to, you know, mum talks to dad. But you know, I think just going at it from different angles and having that open conversation, that this is okay and it's needed, it's necessary. In order for us to find out more, you know, we have to participate in things like trials.
Thank you. And Lorraine, as an expert, as someone who has really led and run clinical trials, how have you ever encouraged people to consider clinical trials?
Well, interestingly, the trial I was involved with was Viagra. It had a compound name, it didn't have the name then, it was new, me being a research sister. But what I realised was patients were monitored well, they had their health checks done regularly, they had someone to talk to in the clinical room that they could offload, then ask questions. They weren't in and out the door in 5 minutes, you know. So actually, the patients really got well cared for. They were well informed, their blood pressures were being checked, their lab results were being checked. If anything was picked up that needed to be picked up on, there might be diabetes picked up on a screening visit, that was activated, you know. So it was a really good way of getting your health checked. And as you said, Ifema, you know, going forward, how exciting to be able to change health and how we manage it, and maybe in certain groups as well. So yeah, I think it's having that time to explain things and having a resource where you can see what trials are available or speak to somebody about it. Wow, that's fantastic, you know.
Yeah. And I think, Lorraine, just what you said about, you know, being monitored as well, I think that's a really big thing that should be communicated. So these are things, especially prostate cancer, there is no screening program, you know, there's nothing regular. So being part of a trial where you're being, you know, you're being monitored, you're being checked, there is all the more reason for them to catch something before it turns into anything major, without you having to do too much else. I think is a really good way that we should be communicating it. So,
and not even paying for those tests
yourself. Exactly.
You know, so, and sometimes, yeah, there are all sort of ways of, you know, sorting out about transport, and, you know, I had everyone always attend, you know. I must admit, I thoroughly enjoyed being able to have that dialogue and to listen and document things, because it's important that that documentation takes place. So yeah, it's an important part, and we've seen it with COVID, haven't we? Massively. Look at what's happened here in the last year. Worldwide with trials. So I understand people's anxieties, but that's what we should be able to clarify for people and give them that choice. Yeah.
Right. I wanted to ask just one last question before we go to the questions that have been asked in the chat. Chris, are there any other reasons why men might not consider clinical trials?
Yeah, the fear of the unknown, Kamei, I think. And what I see, actually, I was going to say the same as Lorraine. My experience of clinical trials and the guys that have been on them, and I'm talking about across different tumor types, not just prostate cancer. But actually, it's a wonderful thing, clinical trials, and anyone who has the opportunity should definitely be able to go on it. Should go on it. I would thoroughly recommend it, because exactly for that very reason, you're never monitored better than if you're actually on a clinical trial. The one problem with clinical trials, as I see it, is communication, right across. Communication is the biggest problem we have in the world, probably anyway, ridiculously, that we have so many ways now we can communicate, but still it's the most difficult thing that we can't do properly. But actually clinical trials now and technology are very linked. And the fact that there is progress now with clinical trials, and in some ways it's so fast moving that I find here anyway in the NHS that the general NHS people struggle to keep up with actually what's available, because that's changing so quickly. And it tends to be that if they don't really understand it and they don't know much about it, they tend not to say anything. So rather than say, oh, actually, I do know of this trial, but I'm not sure about the detail, they tend to keep quiet because I suppose, let's be honest, it's hard for them to recommend something they don't know much about. So I see it in prostate cancer that actually it's like going into a restaurant to sit down and eat, and all you get is the takeaway menu. You actually don't get the full menu, what the possibilities are for you, because generally, you know, we've been dealing with prostate cancer much as we have with any other cancer, the same for the last 100 years. You know, we either chop it out, we burn it, or you know, with radiotherapy, or we poison it. You know, those are the three alternatives. And basically, unless we do clinical trials and we do it properly, we're never going to learn anything. We're still going to be in this position 50 years' time. So, you know, the issue around clinical trials is the availability of it. And people, the consultants and that we deal with, they must know more about it. They must be better educated to offer the full complement of services. Not just, oh, okay, you've got prostate cancer, there's your radiotherapy, there's the option for chemotherapy, there's the option for surgery. You know what I mean? That's like eating a cheese and pickle sandwich every day. You know, we've been doing that for so many years.
Yeah, I completely agree on that, Chris. I remember we actually had to look up what other trials were. When my dad had to be pulled off the Stampede trial, we had to look up other trials that were available and then suggest them to our research team. So that was a little bit, yeah, and I wish I knew something like Ancora existed at the time, because that was quite stressful. Like, we were the ones that were going out and looking for trials, and they didn't really know too much about them, and said, oh, we'll look into them and, you know, try and find out a little bit more, but they didn't seem to be like a sort of, you know, central knowledge hub, if you will, for the people that should be the experts, or that you'd think should be the experts.
Thank you very much. Now, we have had some questions in the chat, and unfortunately, we are not able to give any direct medical advice. So to the panelists, I'm going to ask if you know where to seek help for these following questions. The first one is, I have been having some problems with passing blood and semen. I've spoken to my GP, who after taking blood sample advised that my PSA level is not unusually raised. I am due to have a further blood test next week, but I'm worried what might be causing this and what advice you can offer. Maybe someone can say where.
Sounds like you, Lorraine, and that one.
Yeah, I would, if it's from a GP level and you're anxious, you don't feel reassured, I would ask if you could be referred to see a urologist who would investigate that further. Yeah.
That's been quite common, actually. We've had situations with guys talking about that issue.
Yeah. And it can happen after prostate biopsies, big time, that people can have that. Obviously, like you said, Kamai, just now, the history that the question's from, there's all sorts of things you'd want to know. But in prostate cancer, getting the diagnosis and having biopsies, and some people get told, oh, you might have a little bit of blood in your semen. Well, some men come in and go, oh, I couldn't believe it. I don't want to have sex again ever, or get an erection, because it was like claret, you know. So there are different levels, but from that person who's asked the question, GP's got some history. If he's not feeling satisfied with where he's at, he could ask, could he be referred to a urologist?
Yeah. I think, you know, just always knowing that you can ask for a referral is an important thing. You know, your GPs, they will always do their best to, you know, try and make sure that they reassure you and try and make sure that, you know, that they're doing their best to diagnose whatever it is needed, but they are general practitioners. So if you're not happy, you know, it's always important that you feel confident enough to ask for a referral. I always feel like, you know, you sort of will know when something's not quite right. And, you know, having that confidence to be able to say, well, you know, I'd like to just get it checked out is very important. One of the things that I found surprising a few years ago doing research was back in 2017, only like 51% of GPs sort of knew that, you know, Black men had a high risk of prostate cancer. My dad, you know, had a slightly higher than normal PSA reading about 10 years before he got his advanced reading, and he was due for another checkup 3 months afterwards, and he never got that second checkup, and he'd been to the GP since, you know, for other things. So I think it's just important that you have knowledge, you know, that you understand, you know, sorts of things that maybe you might be at risk of, and if you don't feel something's right, you're always able to ask for a referral.
Thank you. Another similar medical question. Can I ask for surgery? Can I ask for surgery for bone mets? My dad developed steroid mania. So after surgery for bone mets, my dad developed steroid mania. Have you seen this before in prostate cancer?
I haven't.
I don't understand steroid
No,
mania.
no,
I've never heard that expression.
No, either have I.
I wonder if that's something unique to the country or the culture of that person asking the question. I've not, the two of us haven't. Yeah.
Afterwards, I will be sharing the social media accounts of the panelists, and any direct questions can be given there. And then lastly, there was a comment about a person who felt that there wasn't support for us as a family, and especially as a medical family. We were expected to know what to expect and do. So especially Ifoma and Chris, in the support communities that you actually run, what kind of support is there for carers and for family members?
Wow. Ifoma, do you want to go first?
Sure. There are a few different groups that exist. Chris has already mentioned that he runs some groups. I think definitely, and those, and Chris, keep me honest, but those are open to both men and women. So, you know, that's something that the family can attend. There are some other charities that exist. Specifically, I know, I guess, more within the Black community, there is a charity called Cancer Black Care. And they have a lot of information, you know, not just for the person that's been diagnosed with prostate cancer, but also, you know, for the family, and are able to provide some support there. The Orchid charity, and I can share their details as well. They do a lot of work around, you know, just providing support for families, and also for the people that have been diagnosed. They do a lot of talks, a lot of sort of sessions that people can drop into as well, and the Errol McKellar Foundation also have a few different activities and sessions that can be attended. So they've got, I think they've just launched like a walk and talk type session, and I think that's open to everyone. I need to double check, but you can do that. They have also groups that you can attend as well. So I think there's a few, but those are specifically, obviously we don't know who's asking. Those are sort of specifically within the Black community, though I'm sure anyone can be welcome into those.
What I'd say to that is, you're right, some of the ones you've mentioned, Ifoma, but I would recommend, personally speaking, is online. Actually, and that's, you know, that's black, white, and anybody, quite honestly. The help, I know, for all tumour types, particularly Twitter. I mean, that's my choice of place to go. Actually, there are some incredible patient experts on there that just are there to share their own experiences, that have been through the journey, they're going through the journey. There are bloggers, and actually the social media side of support. There are support groups. There are support groups up and down the country. I mean, I don't know where that person's coming from, but I'm talking about the UK. But online, I would say, whichever country you are in the world, you will find support for whichever your issue. Prostate cancer, there is a very, very strong community online, particularly on Twitter. I mean, people run Facebook groups, closed, open, you know, depends on your situation, whether you're even used to using social media. But if you're not used to using social media, I suggest that you start, because there really are some incredible support people out there that can, you know, they've been where you are. Sometimes when we're sitting there as a cancer patient, we think that, oh, we're the only one that's going through this, you know, my arm aches, or, you know, my leg hurts after I've had this. Am I, you know, I'm the only one that's happened to? Well, actually, you're not, because there's a lot of people sitting all around the world asking the same question. And I would thoroughly recommend online work. Yeah, okay, there, you know, people, they're very cautious about online, and rightly so. But actually, it won't take you long to find the real pioneers of prostate cancer or of any cancer online. And if anyone wants to get in touch with me personally, they can through when you share the details. I'll be able to put them in touch with some people if they'd like that.
And I think going back to communication, like you were saying earlier on, that wherever you're being managed for your healthcare, communicate that you'd like some support for the family and carers, because if you don't ask the question, then people won't know, and you might be struggling, needing that. So ask the team, because it may be there is someone within the hospital setting or the clinic setting that actually they didn't think about telling you because they thought you were all coping fine, or, you know, so I would definitely ask there as well. And they may be able to guide you to external sources online that are safe, secure ones, so the information that you get is accurate.
I think the key is to all of this. Oh, sorry. Is actually what I want to try and do is, and I encourage that for all the patients that I speak to, regardless of what tumour type they are, is that nowadays, whether we like it or not, we must be a proactive patient. We must be very, very active in our own healthcare. I think we spoke earlier on, or somebody spoke earlier on, about responsibility of government. I think maybe it was offline we were talking about. But actually, no one is going to be more responsible for our health than we are. Doesn't matter what the system says, doesn't matter what the government says. We know different. We know how difficult it can be. So we need to speak up on all occasions. Sorry to disturb you.
No. So I just remembered there was one other site that I was going to raise, just actually on the Prostate Cancer UK site. They've got a number for specialist nurses, and they are actually brilliant. I'd spoken to them sort of quite early on in my dad's diagnosis, and you know, they were able to point us in different directions and just sort of help talk through things as well. So the number is on the Prostate Cancer UK site, and for those people that are in the UK that need it, they were very helpful.
Thank you so much to the panelists. There actually is a clarification here to what steroid mania is. It was caused by being put on dexamethasone and prednisolone after surgery for bone mets. It's apparently very rare.
Oh,
yes.
We learn something new every day, don't we?
Exactly. So true.
It's better to put your hand up and say, I don't know, than bluff it out.
Well, I do know about the steroids, actually, what the damage it does to your bones, that's for sure, because I have a similar problem. So I know that overuse, well, not overuse, but, you know, extended use of steroids can well give bone problems later on in life.
Yeah.
If I understand, very limited, I think steroid mania sort of is more around the mind and, you know, sort of psychosis around or sort of leading towards that way. So, yeah, if they can talk to someone and maybe get some help just from someone who can talk to them from a mental health perspective, and just look at what they can do from that side of things to help, you know, talk through it with them. I don't have that much information, but just, you know, just if they can ask for someone from a mental health perspective,
or a clinical psychologist might be able to help, do you think, that sort of thing?
Yeah.
Thank you to the audience. Thank you so much for joining us, and I hope that this has been an informative session. Make sure to follow Ancora.ai for more info about trials and to register on Ancora.ai. Thank you very much to the panelists, and we hope that you have a wonderful evening.
Thank you.
Thank you.